Hi, hello everyone. Welcome to Dr. Ravichandra Official. Please like, share, and subscribe Dr. Ravichandra Official. In this video, we will discuss CNS tumors, which are of utmost importance. First, we will discuss the gliomas. The gliomas are of astrocytomas, oligodendrogliomas, or ependymomas. Astrocytomas are of four grades: grade 1, grade 2, grade 3, grade 4. Out of them, grade 1 and grade 4 are carrying the importance because of their prognosis. Grade 1 is having the good prognosis and grade 4 is having the worst prognosis. Grade 1 is called as pilocytic astrocytoma and it is characteristically seen in children with BRAF mutations, and there will be a cerebellar cystic lesion with Rosenthal fibers. Remember, cystic cerebellar lesion and children, and these are GFAP positive. Rosenthal fibers are seen. Pilocytic astrocytoma, grade 1, good prognosis. Coming to grade 4 astrocytoma, that is glioblastoma multiforme, earlier called as, now it is glioblastoma only. These are having butterfly gliomas, serpentine necrosis, glomeruloid-like bodies, and the mutations are of IDH wild type. They will have bad prognosis. Coming to oligodendrogliomas, they are well circumscribed lesions. They have fried egg appearance and chicken wire blood vessels, and these are because of co-deletion of 1p or 19q, and the mutations involved is IDH mutant type. These we are having a good prognosis. IDH wild type has bad prognosis and it is involving resulting in glioblastoma. Oligodendroglioma IDH mutant type, good prognosis. Coming to ependymomas mostly involve fourth ventricles. NF1 and NF2 genes are involved. The characteristic features of ependymoma will be there will be perivascular pseudo rosettes. This is pilocytic astrocytoma. See the cystic lesion within the cerebellar region, and these are the Rosenthal fibers. This is oligodendroglioma. You can see the fried egg appearance. The nucleus is in the center, surrounded by vacuolated or clear cytoplasm. Another showing with arrow. These are oligodendroglioma fried egg appearance, and you can also appreciate chicken wire blood vessels in the corners. This is glioblastoma multiformis. See, if you draw imaginary line, you can appreciate butterfly. So these are called as butterfly gliomas. And this is serpentine type of necrosis with peripheral pseudo palisading of the nuclei. Serpentine necrosis. And these are glomeruloid bodies. And in the ependymoma, you can appreciate the perivascular pseudorosettes. After the gliomas, next primary brain tumors are medulloblastomas. These are the most common malignant tumors in childhood involving the cerebellum. They are highly malignant, but they are also highly radiosensitive. They will are having showing a characteristic metastasis, that is drop metastasis. They will send drop metastasis to the spinal cord. Medulloblastomas are well circumscribed lesions, densely packed with small round blue cells. They are also having Homer-right rosettes. Deletion of 17p is seen in medulloblastoma. Coming to meningioma, whoring of cells with some homobody is seen. The progesterone receptors are positive, and in the radiology, you will observe dural tail sign positive. and meningiomas are common in females. Next, coming to rosettes, there are two types of rosettes, true rosettes and pseudo rosettes. Flexner Wintersteiner rosettes are true rosettes. They are having empty space in the center surrounded by the cells arranged in like flower, that is rosettes. And Flexner Wintersteiner rosettes are seen in retinoblastoma. Homer Wright rosettes are having central pink material around which the cells are arranged in rosettes. They are called as Homer Wright pseudo rosettes. P for pink and P for pseudo. Remember like that. And these Homer Wright rosettes are seen in neuroblastomas, Ewing sarcomas, medulloblastomas, and in few cases of retinoblastomas. In this picture, you can appreciate the center empty space surrounded by the cells. These are Flexner Wintersteiner rosettes. In this pink pale material is there at the center surrounded by the nuclei or the cells, and these are Homer Wright rosettes. This is the brain radiology showing here the mass is there, and this is characteristically meningiomas, dural cell positive, and you can see the whirling of cells, and you can appreciate the samoma bodies. So the most common tumor in the brain is metastasis, and the metastasis secondaries in the brain come from the lung, breast, kidney, skin and skin tumors. So the primary tumors compared to the primary tumors, secondary tumors or metastatic tumors are the most common tumors in the brain, and the most metastatic tumors come from lung, breast, kidney and skin. The most common primary tumor is, in benign conditions it is meningioma, and in malignant it is gliomas. Next, schwannoma. Schwannoma, they are presenting with tinnitus or hearing loss, and most of the times 8th cranial nerve involvement will be there in most cases when compared to 5th cranial nerve. 5th cranial nerve involvement is also seen in few cases. On histopathology, you will be able to appreciate a well circumscribed lesion consisting of dense eosinophilic hypercellular areas called as Antony A and loose hypocellular areas called as Antony B. There will be true palisading of the nuclei, and you can see the area where there are no cells, that is called as verrucate bodies. Verrucate bodies are characteristic of schwannoma. Antony A and Antony B areas are characteristic of schwannomas. Schwannomas are benign peripheral nerve sheath tumors. They can also be called associated bilaterally involving the acoustic nerve. Then they are called as bilateral acoustic neuromas. The chromosome involved is 22 and the gene is NF gene. And these schwannoma will show uniformly S100 positive. And on radiology, in the left CP angle, you can able to appreciate the schwannoma, which is typically looking like a ice cream cone. That's why it is called as ice cream cone sign. So ice cream cone sign positive on radiology, the answer is schwannoma. In the picture, ice cream cone sign, this is the left CP angle schwannoma. It is looking like a ice cream cone, so it is ice cream cone sign. And here, if you can see hypercellular areas and hypocellular areas, dense eosinophilic areas, loose areas, these are Antony A and these are Antony B. This is true palisading, the nuclei are arranged, and this is Verrucate bodies. Verrucate bodies. As a part of completion in the CNS, along with the CNS tumors, I am going to discuss few neurodegenerative diseases with their protein inclusions or bodies. The Negri bodies are characteristic of rabies that everyone know, and asbestos or ferruginous bodies are seen where there is iron deposit and they can be stained with pearl stain. In the first neurodegenerative disorder is Alzheimer's disease, which will present with the symptom of dementia, that is loss of memory. And when we observe the brain, you can appreciate flakes and tangles and flame cells and Hirano bodies in Alzheimer's disease. Flakes represent A beta amyloid deposition. Neurofibrillary tangles are because of the tau protein, and Hirano bodies are because of the actin. Coming to the Parkinson disease, in this there will be hypokinetic movements, and this Parkinson disease is because of loss of dopaminergic neurons from substantia nigra. There will be alpha synuclein protein inclusions called as Levy bodies characteristic of Parkinson's disease. Coming to the next neurodegenerative disease, that is Huntington's disease, where triple nucleotide repeats mutations are seen, CAG repeats. Hyperkinetic movements are seen here. Hypokinetic movements are seen in Parkinson's disease, whereas hyperkinetic movements are seen in Huntington's disease. CAG repeats are seen at the axon, and these involve the caudate and putamen. So there will be degeneration of the caudate and putamen, and there is characteristic Huntingtin protein because of the polyglutamine repeat expansions in Huntington's disease. Thank you for your patient listening. Please like, share and subscribe Dr. Ravichandra Official for such interesting videos.